Hello everyone. Today I'm going to talk about how to write a clinical documentation note. So the most common documentation note which is structured is called the DAP note. And the DAP stands for D, data, A, assessment, and P, plan. So in the first part of the data, you write what information you have in order to conduct the assessment, right? So the patient demographics, history of present illness, and so on, right? And then once you write all the data, you go into assessment and to assess the patient drug-related problems. And then in the plan, you see what you are going to do. So let's start with the data. So what's the usual content of a data? When you write a DAP note, first you think about demographics, patient age, sex, height, weight, history of present illness, why you are seeing this patient, right? That's the history of present illness. Patient was complaining of some symptoms or has illness that's uncontrolled. And then you write past medical history. Past medical history, the patient history, like for example, previous history of hypertension, diabetes, and so on. And then you write medications, the current medications the patient's on, right? So what medications he's taking, for how long, is the patient adherent to taking those medications? Write some labs, if you have lab tests, investigations like chest x-ray, any microbiology, and so on. And the important piece here, that the data should be relevant. You don't have to write everything, the whole story of the patient. You need to write the stuff that are only relevant to you, to that assessment that you are doing. Once you have the data that's complete and relevant, you write the assessment. You write the DRP statement, so drug-related problems. And the DRP play like if there is any side effect from the medication, if there is a disease that's not controlled that needs a treatment, and so on, or poor adherence to drug therapy. And when you write a DRP, here are some tips. Okay, so first, the problem statement should include the patient name, whether the problem is a potential or an actual undesirable sign and symptom. What does this mean? If it's like actual, a patient is actually experiencing a side effect, or a potential, it might happen because of a drug interaction. The sign and symptom disease that's undesirable. So a patient is at risk for anemia because, so that's the condition, right? Patient is at risk for renal toxicity because. You need to state the drug name. Because of what? Did the patient is getting gentamicin, for example, an aminoglycoside, or anything that actually could cause nephrotoxicity. Okay? And then you state the cause or relationship to drug therapy. Why? Like, why do you expect this could be a potential problem, right? This could be a drug interaction, could be a common side effect for the medication, could be a very high dose, small dose that's not effective. So that's something that you think about. After you write the assessment, an important advice here, don't write new data in the assessment. Then you go into the plan. The plan, which is actually what you actually are supposed to do, right? Actions to be taken. So are you going to stop a medication, to add a new medication, increase the dose, and so on. Non-pharmacological therapy as well. And also in the plan, you need to mention about the monitoring and the follow-up. So what do you need to monitor? For example, if you are treating a patient with diabetes, do you need to monitor hemoglobin A1C, diabetes complications, and blood sugar, right? And who will monitor? Is it like the doctor, or the pharmacist, or the patient, right? Like, for example, monitoring blood sugars at home. And then when to monitor, like at what time you need to monitor these follow-up parameters. And that's it for today. Thank you very much. See you. Bye.